Good afternoon, everyone. I'm Dr. Jazz Atwal, Deputy Chief Provincial Public Health Officer for Manitoba. Today, Manitoba is confirming its first case of monkeypox. Several other provinces and territories across Canada have reported cases in recent months, as have countries around the world. We can appreciate that many people will have questions about this case. However, we need to balance that against our responsibility to protect the identity of this person. As a result, public health will not be providing more information at this time about the individual, such as their RHA of residence, sex, age, or vaccination status. A public health investigation is ongoing, and it indicates this person likely acquired monkeypox outside of Manitoba. This work also includes contact tracing, so if he could find out if this person had contact with other people who could have also been exposed, and that will guide our next steps. If a location where others might be at risk is identified, public health will notify them. However, at this time, we believe this is an isolated case. In general, monkeypox does not spread easily through casual contact, but it does spread through contact with lesions and body fluids, contaminated items such as clothing or bedding, or through respiratory droplets from prolonged face-to-face contact. In line with international trends, the majority of confirmed cases in Canada reported intimate sexual contact with other men. The risk to the general public remains low, but it is important for everyone to be aware of monkeypox, so those that are at risk can take steps to reduce their risk and seek care and get tested if they develop symptoms. I want to reassure Manitobans that we are taking important steps to monitor and respond, which includes our vaccination campaign that's ongoing. And while we know that anyone can be infected with monkeypox regardless of race, gender, or sexual orientation, we will continue to focus our vaccination efforts to those who self-identify as members of the gay, bisexual, men who have sex with men community, or the GBSM community, and within that group, who are at most risk within that community based on the data that's available. We do not expect that most Manitobans will need to be immunized against monkeypox. However, we will continue to work with the federal government to make sure supply of vaccine we have available aligns with the demands from the eligible populations. As of August 14th, 168 doses of monkeypox vaccine were administered to eligible people in Manitoba. We will keep updating that number online every week going forward. Vaccinations continue to be available for eligible people across the province and can be booked online. People who don't have online access can call HealthLinks for assistance. For the first time, walk-in vaccinations will be available at 490 Hargrave Street in Winnipeg next week on Tuesday, August 23, Wednesday, August 24, and Thursday, August 25 from 9 a.m. to 3:30 p.m. People should get vaccinated if they are eligible, but there are also other ways to protect yourself. We've got a full list of recommendations and resources online, but you can be aware of new rashes or sores on yourself or a partner and seek medical attention. Stay home if you're sick, use condoms, consider minimizing the number of sexual partners you have, and don't share personal items and wash your hands regularly. I want to thank all of our partners and community organizations who we are working with closely to help make sure eligible people can be immunized without barriers and without stigma. We will continue to update information on our website and share new information with Manitobans as soon as it becomes available. With that, we'll go to questions.
How likely is it that Manitoba is able to detect all of the cases of monkeypox right now? Is it likely that there are other undetected infections?
There's always a possibility of having undetected infections happening. Some people might have such mild symptoms they haven't sought out care. This individual did what was asked of them to do and sought out care when they did, and that's how this case was detected. We have another surveillance technique where we're looking at other samples that physicians or nurse practitioners will take a sample of from a person that may not have been done for monkeypox specifically, but that we have tested for monkeypox, and all of those at this point have been negative as well.
Are you able to say, you said out of province, is it elsewhere in Canada or is it international?
Again, we won't be identifying any more information about the client. We need to protect this individual and in future protect the individuals who may become cases.
How many doses does the province have access to of the monkeypox vaccine?
There's a limited supply of vaccine that's procured by Canada or Health Canada. So we have an allotment of that. As we need vaccine, we are getting our vaccine from the federal government, and there have been no issues with the allotments that have been provided at this point.
And you're having these walk-in clinics. How many doses do you expect to give out over these, I believe, 3-4 days?
It's really hard to know. We've had pretty good uptake in relation to vaccine with available appointments with the partners that we've had. On a walk-in basis, we're not too sure exactly how many people will show up. Vaccines also available by appointment, not just within Winnipeg, but throughout all the regions in Manitoba as well. So you can look on our website to access vaccine. You can call Health Links if you aren't able to access the internet. And you could also reach out to your public health unit that's local to see if you could access vaccine through them as well.
Is there any intent to expand eligibility?
So we're going to continue to follow the epidemiology related to risk in Manitoba. And obviously, as epidemiology changes, we'll take a look at that and determine if we need to expand that eligibility within Manitoba.
Is Manitoba considering changing or modifying the recommended isolation period for people who have been infected?
Do you recommend changing the latent period?
No, the isolation period, right now it's recommended 4 weeks.
Right, so basically it could be up to 4 weeks. What we're doing with cases is we'll be active monitoring the cases, and a patient could be infectious until all of the lesions have cleared up or have had a new layer of skin form over top. So that could take up to 4 weeks. It might be a little bit longer than that, but we'll be monitoring the cases in relation to that.
Do you expect any uptick in the vaccine take-up following today's announcement?
I think what we've seen is we would expect a bit of an uptake. I think because we haven't had a case in Manitoba at this point, we were really focused on, getting vaccine out pre-exposure. Manitoba actually led the way in relation to providing pre-exposure vaccine to individuals without having a case in the jurisdiction. So I think we'll see a bit of a bump, but it's really hard to know. Again, appointments are available, and we do encourage people who are at risk to look at that eligibility criteria and book their appointment.
Because we don't know how many vaccine doses have been acquired, are you confident that the province has a sufficient pool of vaccine doses to respond to however many people are in the at-risk, the eligible group, if they are to turn up for vaccines?
Yes, I mean, we have a vaccine supply. If we need more vaccine, we're able to get those allotments from the federal government as well. So we are comfortable with the amount of vaccine that we have in the province right now, and to meet expected demand with the announcement today of having a case confirmed in Manitoba.
On the COVID vaccine front, is there any plan that the province can announce now for the rollout of booster doses for the 5 to 11 age group?
So that announcement just happened with NACI today. So we'll be providing some more updates on that next week. We're just working through that and the recommendations that we'll have from a public health perspective. So that update will be provided next week.
And are there any changes at this point to increase eligibility of fourth doses? I know Dr. Rusin said last time that we would hold off on that. Is there any thought to making the current vaccines available to those who want them before the bivalent vaccine becomes available?
I think there's a lot at play here right now. We have recommendations for our vaccine recommendations right now. We're going to have an update coming out next week that'll specifically talk about the 5 to 11s. I think there's still some more information that has to come in that we have to learn about regarding, let's say, a bivalent vaccine as well. So I'm not prepared today to make any announcements related to that. Again, I think you have to give us a little bit of time, get some more information from our partners, and make that best decision that we can for Manitoba regarding vaccines and boosters and what would be available to everyone.
Just on the issue of monkeypox again, contact tracing and also, I guess, vaccine, people coming forward for vaccines. The concern you raise about privacy and safety, for people who are concerned about coming forward because of any public perceptions they may be afraid of, what you have to say about the kind of the way in which their information will be protected when they come forward, or if they test positive for the monkeypox?
We deal a lot in public health related to, certain diagnoses, certain conditions that are very sensitive. We have dealt with lots of stigmatized populations in the past. We work with groups who represent those populations. Our public health staff are adept at dealing with clients and cases and providing the best level of information for them as well. And we protect all that information. We don't provide that information to anyone else for really any purpose at all. So we don't provide identifiers. Just like today, it's high level. That's how we're going to keep it. We continue to work with non-governmental organizations as well. We're working with groups that represent individuals or individuals at risk here and on grassroots community groups that work with these individuals as well who are part of this community. We're going to continue to work with them to talk about, educate, and to provide that vaccine as well.
All right, thank you very much, folks.